My name is John Ferguson. I'm the Chief Medical Officer at Austin Health, and I've been here now for just on 7 years. One of the things that's always been a passion, I think, for us and for myself is the health of our Aboriginal community. What many people may not know is that before European settlement, the health of the Aboriginal community was actually better than that of the European community. And with the settlement of white men came a lot of diseases and a lot of other issues that have since created a gap between the health of our Aboriginal community and of our non-Aboriginal community. In 2005, the Commission for Social Justice did a review of this with the intent being how can we gain equality of health for all of our population. In 2008, this was taken up by the federal government under the program called Closing the Gap. And that program set a target of health equality for our Aboriginal community over 25 years. Now, since that time, that gap has closed, but there are still major differences and discrepancies in the health of our Aboriginal community and that of our non-Aboriginal community, particularly in areas like cardiovascular disease, renal disease, paediatrics, mental health, dental health, and a raft of other processes that underpin all this. What's happened at a Victorian level is the government has a program called Coolin Ballot, and that translates to healthy people. And that recognises that health is not an isolated aspect. It sits within a context of a full community response, and that involves the social determinants of health, such as education, accommodation, employment, family strength, social feeling of commitment, and incomes. At Austin Health, we have our program called Narajarrah, and that means, or translates as healing in the local language. What I would encourage all our staff to do is to liaise with and engage with our Aboriginal liaison officer and the full team to ensure that we can guarantee equity of access, equity of treatment, and equity of outcomes for our Aboriginal community.